Sleep apnea literally means without breath. It can cause fragmented sleep, shorter lifespan, reduced quality of life, and even death. It is estimated that left untreated, sleep apnea can reduce lifespans 7 to 15 years. At Lone Star Dental Sleep Medicine, Dr. Harry Suggs screens and treats patients with obstructive sleep apnea.
Sleep apnea is where you stop breathing for a certain number of times per hour. If you wake up several times an hour, then your body never gets into deep sleep. You never get the REM sleep. Your body never gets like reconstituted at night. Your body and your brain. Your brain files all the activities that you had that day, and it can't do it, and it affects your memory. You can't remember names, you can't remember instances, because your body never got the opportunity to get into that filing cabinet because you never got into the deep enough sleep. When someone goes to sleep and they're laying there in the bed, the body says, relax. And all of your systems start slowing down. Your muscles start relaxing, your whole body starts relaxing. When that happens, your airway starts closing down as well.
Basically, when you sleep, air travels through your mouth, down your throat, into your lungs. The narrowest part of the airway is at the junction, where the soft palate, the tongue, and the back of the throat all compete for the same space. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissue begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it can cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea. More than 18 million Americans suffer from obstructive sleep apnea. 90% go undiagnosed.
Snoring is sort of a telltale sign. Because you snore does not make you an apneic, but it's like a forerunner to future problems on there. So snoring should not be ignored. Multiple times we have especially men that come in and they say, I don't snore at all. And the wife is with them and she said, oh yes you do. You sound like a freight train.
A study from the Mayo Clinic found that spouses of snorers woke up at least partially an average of 21 times an hour, nearly as often as the 27 times the snorers woke up from sleep apnea.
A person who has apnea, they think they're asleep. They don't hear themselves stop breathing. They don't hear themselves snoring. So it's real important to interview the bed partner because they're the one that really knows what's going on.
Other signs can include sweating during the night, fatigue during the day, morning headaches, suddenly waking up unable to breathe, waking up feeling tired, losing interest in sex, feeling sleepy during the day, falling asleep at work, school, or church, or while driving, restless sleep, tossing and turning, and concern that your quality of life is affected by fatigue.
Certainly one of the first things is that you wake up tired in the morning. And sometimes you have a headache, sometimes you don't, but it's just hard to get up. You don't feel refreshed from a good night's sleep. You feel like you worked all night and you just can't get it going.
And the list of serious health problems is long. Obstructive sleep apnea is associated with an increased risk of cardiovascular disease, high blood pressure, diabetes, stroke, and arrhythmias.
The comorbidities can include high blood pressure, diabetes, any kind of cardiovascular problems. And so people need to really take this seriously. The science is all behind this. The key is to be tested. You're not going to know if you're an apneic unless you're tested. Here in the office, we do pre-screening, and then we send you to a sleep lab, and the sleep lab does a definitive study, and they make it as comfortable as possible. It's a nice bed, and they make it look like a bedroom, and so it's just about the same as sleeping in your own bed at night.
Along with the sleep lab test, Dr. Sugg uses the latest technology to get a full picture of the patient's airway.
We do a physical examination of your airway to see if you've got an open or constricted airway. We also do something called a cone beam, and a cone beam is very sophisticated equipment that tells us with a calculus computation exactly the minimum size of your airway. When we send you for a sleep test, we're 99% sure that you're an apneic and you're not going for nothing. The cone beam CAT scan is a marvelous piece of equipment that we can just test the upper part of the airway without exposing the rest of the body to any radiation, and we get all sorts of findings.
And if a patient has obstructive sleep apnea, the two most commonly used treatment options are the CPAP machine or an oral appliance.
The machine is blowing air into your nose and into your lungs on a continuous basis. And so you're breathing with it, and you're also breathing against it. And it holds the airway open. And it's excellent for the people that can tolerate it, but there is just a very small percentage of people who can actually wear it and wear it successfully. If a person has been diagnosed with a CPAP and they are having trouble tolerating it, which most people do, it's very easy for us to make an oral appliance for them that they can wear.
The Academy of Sleep Medicine issued an official statement that a dental appliance can be used as the first line of treatment for mild and moderate sleep apnea and as an alternative to the CPAP for severe sleep apnea.
What this device does is it slightly moves the lower jaw forward, the tongue comes with it, and keeps the airway open.
The oral appliance is comfortable and easy to wear. Most people take only a couple of weeks to adjust to wearing the appliance. It is small and convenient, and the treatment is reversible and non-invasive.
An oral appliance fits people's lifestyle because people are used to wearing bleaching trays, night guards, TMJ splints, and so we find that people have a much higher tolerance for wearing an oral appliance than they have wearing a face mask.
The Academy of Sleep Medicine reports oral appliances are the #1 non-surgical alternative for CPAP intolerance.
One of the things that happens occasionally is someone drops it, breaks it, the dog eats it, or whatever. And we had a man not too long ago that he could still wear it. It needed repairing, but he would not turn it loose for one day, one night to get the thing repaired. And so he's wearing it right now, broken, because once he had that thing, he did not want to give it up even for one night.
Dr. Sugg treats children as well with sleep apnea. While the testing is the same, the symptoms and treatment can be different in a child.
Yes, children do get sleep apnea. In fact, so many times sudden infant death syndrome, where children die in the crib, so much of that is an airway issue, an undiagnosed airway issue. We treat many young children that are snoring, that are having airway problems, that are having trouble in school. Once we get their airway open, they are a completely different person. They go back to school happy. They start making good grades. They physically and mentally grow. They're taller, and their brain grows larger. And they're actually taller and smarter as an adult.
Young and old alike, Dr. Sugg says once a patient gets the quality sleep they need, everything improves.
I hear every single day what a difference it makes in people's lives. In the people that are around them, they are not just happier, but everybody around them is happier. Their boss is happier with them. Their spouse, their children, everybody's happier.